The trial of the 47 defendants in the Turkish newborn gang case has drawn significant public attention today because of the alleged scale, the brutality of the crimes, and the premeditated crimes. These individuals, comprising doctors, nurses, ambulance drivers, hospital administrators, face charges involving fraudulent activities and deliberate endangerment of infants for profit, it seems. The case has not only shocked Turkey, but has prompted a national inquiry into private hospital practices across Turkey. The primary person who has been accused is Dr. Firat Sari, and I put a little picture of him here. He's an odd individual who appears in two different versions, one with a hair transplant and one apparently without a hair transplant. He previously had associations with the PKK, that's the Kurdish paramilitary organization. After completing an unrelated prison sentence for that, he seems to have established this fraudulent scheme. And on the other side over here, there's information about the network, this clear hierarchy with Dr. Firat at the top, additional senior doctors coordinating with hospitals, hospital administrators, healthcare workers, executing fraudulent treatment and supporting staff, including ambulance drivers and people answering the Turkish version of 999 calls, who directed patients to specific hospitals. And the accused are alleged to have falsified diagnoses, prolonging the hospital stays of newborn babies, or tragically marking deceased infants as alive on official documents to maximize government healthcare reimbursements and to maximize the amount of medicine that they could purloin and then sell on the black market. Babies were kept alive, additionally, on life support or subjected to unnecessary treatments to inflate hospital charges, draining resources meant for legitimate care. There's also video of babies being literally tortured. And this is simply horrific. I don't intend to show you those videos. I have seen them. So, it's what more can I say? There are expensive medicines intended for neonatal care that have been reportedly misappropriated, sold on the black market, further fueling the operation's profits. In addition, the use of social media to coordinate all this, WhatsApp groups, the investigation has uncovered messages within WhatsApp groups where members have discussed children callously, with some even mentioning pulling life support from the children for profit or because they're crying too much. These exchanges, though not widely disseminated because of court restrictions, reveal the ruthless nature of this evil operation. Limited footage has surfaced, which sadly I've been shown on platforms like Telegram, showcasing how deeply ingrained this malpractice was within certain hospitals. And because of the large number of defendants and the complex nature of the case, special accommodation was made in courts for the hearing. And the first hearing focused on preliminary statements by lawyers, procedural clarifications. Prosecutors have called for severe sentences now, amounting to multiple life terms, combined sentences for each person totaling over 582 years. And families affected by the loss of their children have brought further claims of negligence, with some cases dating back years, amplifying the public outcry. And it's important to establish that this is the tip of the iceberg. This problem seems to have gone much further. And the scandal has led automatically to the shutdown of approximately 20 hospitals implicated in the scheme, with others under intense scrutiny. And the case has prompted a nationwide review of neonatal practices, aiming to restore trust in the healthcare system, to prevent further abuse, and to get back to proper practice. The trial underscores the tragic intersection of profit and medical malpractice. And as Turkey grapples with the implications of this, it serves as a cautionary tale about oversight failures, about the potential for systemic corruption within healthcare frameworks. And it is a lesson that I think should be learnt not only in Turkey, not only in the nation where it seems to have occurred, but also beyond. It's something that we need to take to heart. And as our health service is in trouble, we need to recognize that the safeguards that should be in place may not be sufficient. We need to review, particularly as there's been a case in Britain which has some parallels, though I think equally that case has been badly managed. With the Lucy Letby case, but we need to put as a priority the treatment of children and the treatment of the sick and the injured and the dying. The secondary issue is one of blame and punishment. The primary purpose, the primary focus must be on getting hospitals back to their proper service. They are there to serve the community, and one hospital being closed for whatever reason is a disaster. We need to get these hospitals open and working properly, and we need to attract as many good, principled staff as possible, wherever we are. But we need to learn when things go wrong. We need to learn from the errors.